Hello, my dear ones. Well, not as cold. No, after it already got my coconut trees and bougainvilleas, and my bandanas, of course, are gone. And fig tree didn't last too good. Cherry tree didn't last too good. They'll come back, I hope. Oh, man, cold. Doesn't Mother Nature know this is Florida? You shouldn't see any cold or snow down here. What happened to global warming? I was watching that Body Bazaar last night. Oh, my God. I feel sorry for some of these souls. This one poor girl, I mean, I know people don't realize on this planet, a lot of them don't, that the reality of someone that has a physical body is not the physical body. Don't trap me as a soul or as consciousness in a body like this. Get rid of that body. It's just sad. They had one little girl, she's 44 pounds and she's less than a year old. She's so big. The mother's breastfeeding her and she can't quit eating, supposedly. So this little girl, 44 pounds, she didn't look like a little girl. She's eating potato chips out of a bowl. She's eating naan bread. She drinks a liter of Coke a day. She's constantly breastfeeding her. It's like, and these kids look like they're not even grown themselves that have this little girl. So they were going to do surgery on her, cut her stomach, cut 2/3 of her stomach out. And this is a little less than a year-old girl. And then they had her on the operating table and everything, but they had to terminate the surgery because they couldn't find a vein. She's so fat. Oh my God. So then they said, well, you're going to have to put her on a diet. Oh my God. Horrible. That one just actually made me mad because here's a little girl, 1 year old. She's eating normally less like a grown-up, yet she's still breastfeeding. Cheese, breads, potato chips, a liter of Coke. Well, of course she's going to balloon up like an elephant. I mean, holy crap. But there were some really bad cases there that sad stuff. Twins joined at the head. I mean, that's sad what they have to go through. And they look like, those two girls look like they were, like 10, 11, somewhere in that age, and just nightmare stuff. They couldn't break them loose because some of the arteries that feeds both brains, and just horrible stuff. I got to quit watching that. Holy crap. Some of it, though, man, we could fix them like nobody's business. I just go so frustrated when you see the medical profession and can't do anything about it. Your genetics, and you'll have to live that way. And it's like, oh no. And you can see the mom and dad, either pituitary, parathyroid. You can nail it right off. You guys would be good at that. All right. Matter of fact, you guys notice I've got my clinical herbologies up. Let me know how you like it. The nice thing about these classes, when I get the time, holy crap, I'll be able to expand on them, add videos to these classes just to expand on some of this stuff. So if you want me to do any of that, let Marco and Debbie and Nicholas know, and I can always do a video and expand on some of these things. I'm about ready to film The Spirituality of Naturopathy. It's a little bit of an in-depth look at spirituality, but particularly focusing on the mind and emotions and its role in health, and its role in everything in life, and the duality thereof. Duality starts at the etheric level, the individualized level, the ego. So this class is going to be pretty in-depth at looking at creation is put together, the known worlds, what we know from advanced travelers and all of us that have been out of body and teachers and things like this, what we know to be true about how the physiology and even the anatomy, more the anatomy of creation is, and helpful in understanding the relationship of the mind and emotions to the physical body. And that when you're a healer, and I know many of you have experienced this that are helping others, they're doing everything right, but they don't get well. But then you look attitude. You look at some that their egos are really accentuated, some know-it-alls. You've got some that are so emotionally weakened by past experiences and that they're locked. The adrenals are locked down, and you just can't get things moving and get the kidneys moving. And so these are important levels to think about because they're more powerful than the physical levels. Your astral or emotional self is much more powerful than the physical world. And the mind, of course, the creator of all creation, it's the most powerful. And, you've got to look at that as a healer, the relationship of you or your patient or client, them as the consciousness or awareness, but then how are they using their mind and how are they using their emotions and those impacts that have on their physical body. Only a great healer would be able to work with that and know that. And you all are great healers, right? Good. All right, so that class, I'll be filming that class probably in about a week or so. Our PowerPoints are almost done. Megan and Matt have been really working hard for me and making me some nice PowerPoints to simplify the overview of the anatomy of creation and how the different rooms in the mansion, so to speak, as Jesus said, how that is all laid out. This is good to know, All right, this is from Roberto. United States, 57 years young. I can remember when I was 57. 5'4". Robert, you're only 5'4". Holy crap. So we know, especially as a male, we know you've got a pituitary problem. 125 pounds. Right? Concussion for over 5 years. So when you have an injury to the body, and it doesn't get well, what system do you think you have down? You know it can't be the blood because that area would be necroticized. That area would literally die, become gangrenish and all that sort of thing. So, that's not the problem. That's not the system down. So I've always said that when you have trauma to tissue, you have to remove the traumatized tissue. You have to remove the dead cells and everything related to that, right? So what system does that? Not the blood, it's the lymphatic system, absolutely. And those cells that are damaged have to go to where? The lymph nodes. That's where all cells that are damaged one way or another, whether through trauma or whether through the retention of acid waste or whatever, when cells are damaged in the body, they are carried to the lymph nodes where macrophages, other cells, cannibal cells, break them apart. And then it's off to the kidneys to get rid of. Bacteria is not in there, and it even tells you that in A&P, bacteria isn't in there to break down the cells. They're to break down the acids. You're carrying about 3 to 4 pH acids to the lymph nodes. And those lymph nodes, you got to bring those acids up to about 6, or you'll be peeing out 3 or 4 pH. That's like peeing out Coca-Cola, and you don't want to pee out Coca-Cola. Oh, no. So whenever you have a case where you have a concussion like that, you definitely know, and it's not getting any improvement, that you have a lymphatic problem. On the other side of this, when you have a concussion and you're dealing in central nervous system damage or autonomic nerve damage, what did Yale come out with? Oh, the brain converts glucose to what? Fructose because fructose is the number one sugar for neurons. Very important to understand that. When you have a neurological damage, I don't care if it's MS, Lou Gehrig's, whatever the medical doctor wants to label they want to put on it, you've got to move to an all-fruit diet. And I've given you plenty of our past experiences with people that, we put on fruits, they got mobility, then we took them on added vegetables and they lost it. Yeah, that's how powerful an all-fruit diet is to neurological cases. So number one, with this case, I would move to a grape or all-fruit diet. That's number one. Number two, I would get on herbs get on the kit. If you've never been them, get on the kit. It's easy to explain. But you got kidneys, you got lymphatic, endocrine gland, all right? And you got the bowels. The one formula I would add to the first kit or to that protocol would be nerve power. Definitely nerve power. These are tonics. These are also, there's an herb in there to help move blood aggressively to the neurological system. So those are the kind of things you want to look at. You want to move blood more aggressively. That's an alkaline slurry that brings in anti-acid, anti-inflammatory power. So that's where I would be going. And then I've been wanting to be moving my lymph, especially out of here. Let's see what he says about it. My daughter, has had a series of concussions for more than 5 years. Holy crap! Now, she had to leave her job and experiences headaches almost daily with no sign of improvement. Very much so. This is why it's important, too, guys, to clean up the GI tract. Because we've talked about this on many videos, the relationship of that embryonic trunk, which is your intestinal tract now, that transverse portion to the head area. So that's why you see it in these kits. I'm going after the body in all its ways that impact each part of itself. So very important that you're working on the kidneys and the lymphatic system. That's your removal of acids and damaged cells and all that. Because what system does that? You can't dump proteins or damaged cells into the blood. Not smart. You really have a lymphatic system that handles that. You have a sewer system in your body that handles that. Medical doctors just don't understand that yet. They're a little slow at coming along here. But you don't want to be slow because that doesn't help anybody out. Now you're treating symptoms, you're blaming things on genetics and da-da-da-da-da-da-da-da-da-da-da-da. So if this 52-year-old Robert, is that you that's 5'4" or your daughter? If it's a daughter, right off there's pituitary problems. So already, if there's pituitary, I'm just conjecturing here. If the daughter is 5'4", she already has pituitary problems. What brings down the functionability of any tissue in the body? What affects the ability of a cell to function or produce hormones, steroids, neurotransmitters? What affects the cell's ability to function? Not blood. Blood is always seeking an alkaline slurry to give life, sugars, power, carbon to the cells. The other side, however, is the protein, nitrogen side, the acid side of chemistry, and that's the corrosive side of chemistry, always. So you always want to look at that whenever you see symptomology. And so already, let's just conject that his daughter is a 5'4" lady, I can tell you she has pituitary, which tells me already she has sinus and lymphatic problems, which then can lead you right to the transverse bowel. See, and you guys know how to draw these lines now to the causative factors that backs everything up. So trauma to the head would be even more of a problem when you have an already pre-existing lymphatic stagnation in the head, right? Right. So you got to open all that up. You got to fix what the original cause of why she's only 5'4". I'm just conjecturing that this is. She's not, okay. But still, That's what you have to do. And that's why it's so important to work on the kidneys, the lymphatic system, the GI tract, the endocrinology. Of course, that she's already down in that if she's the 5'4" or whatever height. And if the dad's 5'4", I'm sure the daughter is short too. So that would just pull us in even and look at the mother and see where she's at. Yeah, headaches, pressure, all this kind of stuff. She attends group therapy sessions. You know what? Therapy. That always used to get me. These medical doctors, this insanity of, attend to therapy. Why don't get into her body and fix her body? You can't therapy this stuff out. But I see no progress. Yeah, no kidding. And it saddens me greatly as I'm unable to offer her any help. Well, we can. I mean, this isn't difficult, but she's got to, be a little strict on her diet for a while. Really, it depends on how much damaged brain tissue is and all this sort of thing. Go to Dr. Morris's.tv and look at the young child that the dad beat the holy crap out of him and what he did to his brain and how we regenerated brain tissue through mother's milk. But the mother became fruitarian. I mean, it's pretty cool when you see stuff like that. That actually freaked me out. Do you have any suggestions as to where she might turn? I'd greatly appreciate hearing from you, Robert. Absolutely, Robert. And we've got plenty of help on GrapeGate, also handcrafted.health on the Facebook site. But you can call into the health center here and get a hold of Jessica, make an appointment with Jessica or Natalie. They'll be glad to help her and bring her through this. I'm always here to help with these questions and help you put your foot on the right path. But this is all of our counselors, you have to do this. If you're a counselor using my name and you don't put this lady on all fruit, then quit using my name. Because this is vital to go after this poor soul, because it just will get progressively worse. And then all kinds of mental problems can happen. And it's just that's no life to live like that. No way. Everything is fixable. Injuries, all these sort of things. But you have to kind of look at things, preconditioned situations and stuff like this. And so just in hypothesizing this, I have a feeling that she's already compromised in the head, lymphatically speaking, and that these injuries just haven't been able to heal themselves because of that, and the pressure and the headaches and stuff like that. So you're going right into the gut, you're going into the kidneys, you're going to just draw this lymph out of her. And that's why it's so important to be on a fruitarian diet. Doesn't be forever, but it should take her, maybe 4 to 6 months to get out of this. Depends how good she goes, how fast she starts filtering in her kidneys. Remember this, you got to pee in a jar and you got to see this. Get her lymph system moving, because if you can't get it moving out of the head, more pressure, more things can build up, and you got vision to deal with. You got all kinds of things up there, and it's like, you don't want to go there. Fix her now, in other words, Robert. Not let her listen to this video, because she can get herself out of this. I don't know how old she is, but got to do it, because there's no other way. You can't let something like that just sit there and treat it with steroids or whatever. And And I'd be looking at all her endocrinology. I'd be looking at her parathyroid as well. Or calcium utilization. I'd be looking at all of that. That's what we do as good naturopaths. We're going to look at the case. Where she got problems, of course, immediately that's a lymphatic problem, immediately. But what else does she have going on there that's contributing factors? Yeah, don't let her suffer. Man, I only got a few more of these. Uh-oh, short video today. Uh-oh, sorry. This, wow, this gentleman is from Poland. His name is Mateusz. I'm not even going to try it. I just call you Matt. And Matt, 34 years young. He's 6.5 inches tall. 6'1.5" or almost a half. Clubfoot, weaker left limb, allergy, slight, not autism, but so I'm going to say this, Matt. You're going to look at pituitary, no question. You're also going to look at parathyroid, no question. You're going to look at those two endocrine glands, first of all. I like listening to your podcast. Thanks, man. I was born in 1991 with a left club foot. At age 12, my foot began to hurt, due to its shape, and my 3 middle toes were curled under. This is why, again, and I can tell you, the things that I've seen, his body will pull and uncurl that. But what system does he have down? Again, there's only 2 fluid-based systems that directly affect the functionability of cells. And when you see every cell is a genetic cell, but it would stay in place. So what's making things curl and augmentate? And that's going to be your lymphatic system. So that's the first where you're going to go. I'm going to be looking at the pituitary and its growth factors. I'm going to also be looking at the parathyroid and calcium utilization and structure integrity and strength. So with those two can augmentate the physical body. I mean, like I said, look at Body Bazaar, and it's like way out there. But you can see where their problems are. And so this would be where I'd be going there. Let's see, do you send me some eyeballs? What do you send me? Ooh, yeah. And I'll say this, whenever you see, and this is the same thing with the hands, I mean, you also see when someone models and stuff like that, that's all acidosis. You can curl, gnarl, bones turn out of shape, muscles pulling one way or another. That's how the spine, when you're a chiropractor, you know that the spine is held there by muscles. And so when one side gets stronger or weaker than the other side, you're going to see a pull, right? And what would make a muscle stronger or weaker? The lymphatic system. Then, of course, now kinesiology come along, and now it's neural lymphatic points. So that helps to open and release those points like that. So then you bring in massage therapy, and then you start to pull people into the reality of the lymphatic system. Haven't put it together quite yet, but you guys have. So there's where I'd be going too. Lymphatic system, I'd be going looking at your pituitary, your parathyroid for sure. So those would be 3 places immediately I would be going and looking at. See, and another thing, I'd definitely be looking at the bowels. Cleaning up the GI tract for better absorption of nutrients. I've had a total of 3 surgeries. Oh, God. 3 surgeries under general anesthetics. The first, at age 18, involved a bone in my foot being removed from the top and repositioned under my foot because it was growing crookedly upwards. And again, when you see that augmentation of tissue like that, you're going to go in, you're going to bring alkalization to the body, you're going to remove the acidosis, you're going to look at the pituitary, you're going to look at the parathyroid and bring everything into a healthy balance. Then your foot will readjust itself. But now that they're playing with that, I don't know where that goes. But I've given you plenty of cases. Matter of fact, remember that he was a quad, worked for the sheriff's department. He was a C4, C5 quad. Gave him a little bit of this, right? Big shelf, extreme scoliosis to the right. Fell out of his wheelchair and fractured his upper right femur. So his leg healed at a 28-degree angle. You could see the bulge in his thigh, have his x-rays, right? His 11th month, I don't know what it is about the 11th month, but his 11-11 maybe, but his 11th month, his leg pulled itself straight. After being this way for 12 years, pulled itself straight. And he was 2 inches shorter on the right side than on the left, and then he was equal. His scoliosis at the same time pulled itself straight. Where did that come from? I mean, when you see cases like that, it's like, holy crap. Can the body do some incredible stuff? Oh, yeah. And that's where you want to live, but you got to be 100% raw. He was 100% raw, and I think I've told you this case. He wasn't 100% fruit, or he would have got more neurological mobility. He's getting it, but very slower than I would like. But he couldn't get off the vegetable juices. His neighbor would make him vegetable juices all the time. But even with that, his skeletal system realigned itself and fixed itself, and it's like, holy crap. In fact, I have the x-rays here, and he made Fox News and ABC News. And they were just freaking out. They showed the x-rays, and Fox showed the x-rays up on there, and they're going, holy, even the broadcasters going, holy crap. Never seen anything like that. I hadn't either, to be honest with you. But, you know, you got to pay the naturopath. But I'm going, holy crap. Amazing stuff. But the things that augment skeletal, muscle, anything is always going to be the acid side of chemistry. Always going to be. And the blood doesn't augment the body. It feeds it, makes it healthier. So you're always going to that lymphatic system. So you're also going to the endocrinology of the body too as well. I had a second surgery to prevent my toes from curling so much that they could fit easily into shoes. And this is what a point with Body Bazaar the same way. That's all the remedy they had for people with surgeries. And I'm looking at yeah, I get surgeries. I do. I'm not that's what I consider medical. The medical world is surgeries and emergency rooms. But that's it. Because on the other side, I saw some endocrinologists and stuff like that talking to these people, and I'm looking at him thinking, no, where did you get your degree? I mean, I'm just a lowly country boy naturopath, no better than that. My middle toes were splinted, and then a few years later, the other toes were splinted because the big toe was lifting too much after the 3 toes had been splinted. This caused pain when walking. When raised to the maximum, it exposed a sensitive area. Now, it doesn't lift as much and no longer hurts. Yeah, you want to really get your kidneys filtering, get your lymphatic system moving, son. Really want to focus on your lymphatic system. And that, in turn, will fix the neurological side of this and all the sides of this, the skeletal side of this. But I still want to look at the endocrinology of the body. I still want to look at that pituitary for all the growth factors it deals with, and also the parathyroid. I'd want to look at that to make sure you're utilizing calcium enough, and then your structure will realign itself. We've never had a case that I can remember of scoliosis that didn't fix itself. And so, I mean, it's just when you fix the system that creates the problem, then the problem fixes itself. You're not stuck forever with these things. I mean, I've had a lady that was so curved in her fingers. She was like 80 years old, 80-some years old, and she played the organ for her church. She couldn't play it no more because her fingers were like this, right? And so she worked with me and went all raw, went to the fruit side. Well, they went like this. And so, again, ABC or one of the news agencies was in filming a cancer case, and she says, well, look at my fingers. And they put the camera to her, and she made the newspaper with it. And she says, I have straight fingers. She said they were like this. And it's like, cool stuff, man. Cool stuff. That's why getting way up on the alkaline side of chemistry, amazing. Look at Arnold Ehret. He had some amazing studies himself. Incredible stuff on a high fruit level diet. It's just amazing what the body can do, and you wouldn't think bone, it's stuck, it's hot. No. Amazing to see that. The tips of my 3 middle toes were splinted, so they dropped slightly. Is there any way to restore full nerve supply to my feet? Absolutely. And that, again, if you want to get the nervous system rebuilt, you've got to go fruit only. People might think that's weird, but we have way too many years and way too many cases underneath our belt to show you that that's the case. And so that's where I'd be going. And you wouldn't think that. You'd think, well, man, you're going to build the skeletal system. You want to have greens, lots of greens because of the higher calcium levels and stuff like that. Kelp maybe, that sort of thing. Amazing what fruit will do to a body. It's just friggin' amazing. But you can start out with a high fruit diet, or you can do a fruit, salad, fruit, and then move to an all fruit diet. And then if you had to down the road, power up with some greens, throw some kelp or doss in there and power up with that if you wanted a higher calcium. But you got to make sure your body can utilize these things, and that's looking at your endocrine gland. The one thing I don't see here is a picture of your eyes. That would have been really helpful to have a picture of your eyes so we could take a look at what your body looks like from an iridology point of view. Then we can see your legs, we can see how your lymphatic system looks, we can see these things, If you have nerve rings, that sort of thing. Other health issues I have include a severe grass allergy. What system? Broken record, lymphatic. All right, any allergy, anything like that, that's your immune system. Oh, well, wait a minute, what's your immune system? Well, there's only two systems, guys. That's your lymphatic system, right? But I've noticed it getting better year after year thanks to a fruit diet. Good man, which I've been on for 3 years now. You've been on 3 years, you haven't seen any changes with your feet? I mean, you could add some green drinks now and then. You could, with one cooked meal at the end of the day. Get rid of the cooked meal and see yourself slingshot up into another level. I can just tell you, there's such a difference at 100% raw and with just one cooked meal. And there's a huge difference between an all fruit diet and a fruit and vegetable diet, even all raw. I mean, experiment on these things on yourselves. Because don't take my word for them. Experiment on yourselves and watch the difference. Feel the difference, Try an all-fruit level for a few months, then add the salad and see how you feel, And play with that. And then add some cooked food. But get to that 100% raw first and 100% fruit first, and then add these on and see the difference. I always used to tell my clients, 2 weeks, gave them a detox kit for 2 weeks. I want you 100% fruit for 2 weeks. And at the end of 2 weeks, I want you to go out and have what you like, a cooked meal, whatever you like. And then I want you to come in and have another appointment. We'll check you out. And I had never had anybody say they felt better when they ate the cooked meal. Now, we've used cooked meals to bring balance to people sometimes when they get ratted out too far. Absolutely have. But that's a different thinking, That appeases the emotional side of the body. Because remember, we're emotional beings and we're mental beings, more so than we're physical beings. During the pollen season, I fast on watermelon juice. Yeah, you're getting it. Which actually reduces the symptoms almost completely. Yeah, that's your lymphatic system, son. That's your lymphatic system. And, you just got to keep working on it. I thought the allergy would disappear once my kidneys started filtering, but it hasn't. Keep working on it. I don't know what your eyes look like, but look at your eyes and see how much work you had ahead of yourself. Again, I go to this picture or the new one that was sent me. You've just got miles and miles of length. Just keep working it. It's all you can do in life is just keep working it. I also had some vision impairment, nearsightedness, and even a slight autism in my right eye, probably from sitting at a computer. Oh, yeah. Yeah, I couldn't do it. I can't stand TV, let alone sit in front of a computer like that. But it's probably part due to the fact that it is often too dark and too cold here. I don't know. I still live in Poland, but it's probably not a good idea to live here long term. I'd go some tropical place. Just saying. At least to Southern Europe, yep, where fruit is available, is much better, although I quite like dried jackfruit. We got big jackfruit down the way here. I mean, I don't know how these trees do it. It's amazing stuff. But you're on the right path, man. You just got to get more. I would also use a circulation formula just to move blood more aggressively down the lower extremities. At the same time, get your lymph moving more aggressively. Play with the lymph formulas, the kidneys. Sounds like your kidneys are filtering, though. That's all good stuff. But if you're not over the allergy thing, you know your lymph system is a mess, and you just got to keep working on it. And don't you guys like a lot of cheese over there in Poland or something? Nicholas? Help this lad, Nicholas. I think Nicholas still lives in Poland, don't you? Was in Denmark for years. This is Tina. My name is Tina from Australia, and I'm seeking your guidance regarding my thyroid health. Have it cut out. Nah, just kidding. I had a subtotal, not kidding. Holy crap. I had a subtotal thyroidectomy at the age of 18. Oh my God. And I am now 37 years old. Since the surgery, I have been taking L-Troxin continuously. Recently, I have been considering whether it is possible for me to stop this medication. Well, I've had only one case from a thyroidectomy that we got the thyroid to grow back, and we use glandulars. But glandulars are not hormones. People generally use Armour, which is natural T3, stuff around here like that. But you can use a thyroid glandular, not too high of a milligram, maybe 50s or something like that. I wouldn't use over 100, and try to inspire stem cells. At the same time, I'm going to fix the system why I lost the thyroid. And what system might that be? Broken record, the lymphatic system. Now, what about your parathyroids? Did they remove them as well? Or, these guys can go crazy when they go in there. Oh, they're a little swollen, let's take them out too. Really? How would they like yours removed, buddy? And it's like, no. Did they take both thyroids? So, again, you could use like an Armour, which is a natural T3, I think. But then at the same time, if you want to use a glandular, which is raw thyroid tissue, to try to inspire some stem cells to get that thyroid to grow back. But you've had a lot of years under your belt, from 18 to 37. So I don't know, I don't know. But I sure would get 100% raw and 100% fruit. And just see what your body can regrow back. Look at my pituitary. Look at my endocrinology to make sure it's up and running well. How's your fingernails? Look at your parathyroid glands, stuff like this. All that's important in the regeneration of tissue, no question about it. And see what you can accomplish. This is always a good look at what you can accomplish. It's almost like kind of like a self competition. How much can you improve yourself? How far can you get? How high can you get on these programs? Because I'm telling you, they can take you into worlds out there. Your body can realign itself and do some things that it's just unreal to watch. So I don't know. Like I said, I've only had one person grow their thyroid back, and I couldn't remember the case other than that in terms of how long they had it removed and that sort of thing. But then we never hear from people much after they start on some of these programs. Like even my clients, after a year or so, we never would hear from them and stuff. And or they'd come back in after a few years and go, you know what, I dropped off and I couldn't do it. Or, man, I guess I really did it. I really got going good. I did good. Either one of the two. I would like to know, can I safely stop? I can't tell you that. I follow your recommendation, diet and detox protocols. I would, irregardless. If you want to try to stop that, what I would, if it was me, what I would do is I would get a thyroid glandular, and I would start on the glandular. At the same time, you would want to titrate, meaning slowly reduce your dosage and see how you feel. Because when you're taking a hormone, whether it's T3 or 4 or whatever, steroid, hormone, neurotransmitters, digestive enzymes, whenever you take what your cells are supposed to make, they quit making it. And if you had a total thyroidectomy, you might want to, again, see if you have stem cell activity anywhere, and you can inspire the functionability and the regrowth of a thyroid gland. It's not impossible. It's like it's not impossible to grow a third set of teeth. There's been a lot of cases in recording that. But I can't tell you other than that. That's your decision. I'm not a medical doctor, and all I can say is that a lot of people don't want to take these hormones, which I don't blame them. So the safe way to do any steroid hormone, even prednisone, anything like that, you have to titrate, or wham, you can get hit real bad. Titrate. But on my side of it is in regeneration of tissue, I'd be trying to get my thyroid tissue to grow back. They might think that's stupid, but I don't. Like I said, we've had one case where the lady grew a thyroid back. But we've had spinal bifida case. She was born without L4 and L5, which is your kidneys. And on a raw diet in 2.5 years, 3 years, she grew her L4 and L5 back. What the hell was that? I mean, it's amazing to see regeneration. That's why we use the word tissue regeneration, because that's what we're after. We're not after the treatment of anything. That's a dark rabbit hole. With supplements, even if you're trying to treat with herbs, you're not trying to treat with herbs, you're trying to clean and enhance the function of. You're either after the blood, you're after the lymphatic system, or you're trying to increase structure, function, ability of cells. That's your 3 factors of the human body if you want to bring down physiology to the basics. Second, she says, what specific diet should I follow for thyroid support and overall healing? 100% fruit, darling. 100% fruit. You're in Australia. I would do 100% fruit if I can get there. If you work to there, then do your fruit in the morning, fruit at night, and a salad at lunch, but keep inspiring yourself. I'll say this, if you want any type of tissue regeneration, 100% raw is essential. Whether it's a combination of fruits and vegetables or all fruit, all vegetables ain't going to get you too far. You might get skeletal regeneration with all vegetables, but everything has to be raw. And there's a difference between all raw and one cooked meal. There's just a huge difference. It like pulls you down. When you're at 100% raw, I mean, you're turning on levels of energy that we probably don't even know that you can feel. Right? I have always been very slim, and even when I eat well, I do not gain much weight. So again, we're going to be looking at malabsorption. We're going to be looking at your lymphatic. So why'd you have the thyroidectomy to begin with? Had to be lymphatic. So we're going to look at that. We're going to look at your gut. We're going to clean up the gut. We want to make sure you absorb your nutrition properly, because that's another thing you have to. You can be all raw and doing everything right, but if you're not absorbing your nutrients well, what about that? And then your adrenal glands, I don't know if anybody has healthy adrenal glands. Well, then there's your mineral utilization, your sugars. There's a whole boatload of things the adrenals produce. And I'd be looking at all the endocrinology. Could this be related to my thyroid condition or past surgery? I would say this. You would tend to, having a thyroidectomy, tend to balloon up, as opposed to getting too skinny. You would have to have hyperthyroidism to get real skinny like that, right? And having your thyroid removed, to me, everything would go hypo, low, and so you would tend to actually gain weight. I would say this is more going to why you had the thyroidectomy in the first place. Again, I would be looking at your lymphatic system, number 1. And number 2, of course, your endocrinology. And number 3, I'll be looking at your gut, your GI tract. I have also been experiencing hair fall. Is the cup full? You know, remember, when you have these ectomies, when you have these tissues removed, there has to be a cause. And your cause rests on 4 principles. 4, only 4. But when you break it down, there's actually only 2. First of all, there's only 2 fluid-based systems that take care of cells, that either make cells healthy or brings down their functionability. You only have 2. You have blood and lymph. That's all that's in there. All right? So then you got to look at what? There's only 2 sides of chemistry, and chemistry literally is everything here in the physical realm. So no matter whether it's a smell, whether it's a sound, everything is chemistry here. Colors, everything's chemistry here. And so there's only 2 sides to chemistry. So then ask yourself, which system do I have down and which side of chemistry? When you realize that the blood can't be acidic, that answers that question right off. Oh, look, the blood deals with alkaline chemistry. Check. Now, what deals with the acid side of chemistry? Well, the medical doctor's body just dumps acid in the blood. They're willing to dump a 1.5 to 2 pH acid in your blood. Why isn't the body? Oh. Huh. Criminals. So, you've got a whole system for acids, and that's the lymphatic system, lipid-based. When that's backed up, what are you subjected to? Tumors or lipomas, cysts, pimples, boils, those sort of things. That's your sewer system. And in the sewer system, you have bacteria and a lot of fungus, moles, warts, things like that growing on you. It's just your sewer system's backed up. And I am concerned if this is connected to my thyroid or medication. It could be considered medication, but that would have to be acidic. And I'm going to submit to you that the same system that you had to have your thyroid removed, or they didn't know how to fix it, is taking your hair off. And that's your lymphatic system. What breaks down hair follicles? Let's see, is it the alkaline side of chemistry or is it the acidic side of chemistry? Well, if my blood is taking off my hair, see, that's an that doesn't even make sense. It's your lymphatic system. But it's the same system that's why you had the thyroidectomy, whether you had a tumor or whatever on the thyroid, polyps or a goiter. Those are easy to fix. Are there any herbal formula, supplements, or protocols from your teachings that you recommend for someone with my history? Absolutely. I'm going into your lymphatic system like I would if you come to me before you had a thyroidectomy and fix that problem. So I'm going into you and I'm going after your lymphatic system. I'm going after your endocrine glands. I'm going after your GI tract, cleaning it up. But that's lymphatic as well, right? I might do some circulation to get more blood more aggressively to your hair follicles to keep your hair from falling out too quick. But I'm also going to be looking at your parathyroids because that's calcium utilization. How's your fingernails? You know, you're lucky if they don't remove your parathyroid glands. I mean, these guys are nutcases. Sorry. You know, so much needless surgery, it's unbelievable. And then you're compromised the rest of your life. It's just horrible. So you want to go back and fix these things. And you're going to go back and fix why you had the thyroidectomy to begin with. Because there's only a few reasons why you would have it in the first place. And those reasons are always going to be lymphatic. It's really why you remove any tissue. It's not going to be blood causing you to remove tissue. It's going to be the lymphatic system that breaks down things, swells things, tumorizes things, goiters, all of this sort of thing like that. You're going to fix that system. And then being thin, you want to fix their because that just makes sense that you're malabsorbed. You know, get a look at your eyes here. I mean, your eyes tell everything. I'm telling you, if you guys have the money, can take the iridology course, take it and learn iridology. You'll do yourself such big favors. It's unbelievable. It's so simple of a science to learn. And then it's right in front of your face what your body is. What you always need is a raw diet. I will say this. There's no animal that cooks their food before they eat it. Why not? Thank God they don't have the brains to say, well, maybe we should cook this. You don't have a horse saying, well, maybe I ought to cook this grass before I eat it. Then you wouldn't see a horse like you see him now. I mean, it's just like none of that makes sense. Animals eat as nature produces it. That's how man needs to do, or humans need to do. But humans have lost their way. Humans don't even know what species they belong to. They don't even know they're frugivores. The average human has no idea that their physical body is a frugivore body. Even the medical world that's so brilliant in health doesn't even understand that. And look at Kennedy pushing a high-protein diet. Kennedy, I thought you'd be good. And Dr. Oz sitting back like a dumb butt, not even, speaking up to Kennedy about a raw diet. He already knows what raw foods will do to you. And yet some people forget these things. Can't do that. So you want to go after the first detox kit if you can afford it, or at least the Fab 4. I would add a blood circulation. We call it blood mover, or we have circulation on the other line. And start moving blood a little more aggressively so you can get up that. Be a good idea. Butcher's broom, anything that moves blood more aggressively up in the head area. What's that one I'm trying to say? I can't think of it right now. I'd be very grateful for your guidance on how to move forward safely and naturally. That's what I would do. And then you can always titrate off your medication. But the nice thing about a raw diet, it will buffer side effects of chemical medications. That's why you want to be all raw. You'll have a buffering mechanism to that. But I can tell you, I think the reason you're losing hair is the same reason you had the thyroid problems. That's right. Thank you very much for your time and support. Warm regards, Tina. Love you, Tina. Thank you, honey. Yeah, dig in and have some fun with this. Yeah. Fix why you had the thyroidectomy in the first place. Oh, we have eyeball Aruskis. Now, talk about lymph. Holy crap. Matter of fact, this might not be sulfur. This yellowing might be a subacute stage moving in. Look at how thick around this pupil, thick this white is. Super thick. Look at how thick here in the wall of this lesion and the walls. That shows, you see this lesion right here, or lacuna? Look at how thick the lymph is around the wall of it. Thick. It's choking it off, choking those tissues off. Over here the same way. And I hope this is the right side because that's real close to the heart area. So let's take a look at this. It definitely has to be a female. Look at that mascara. Look at this. Starting to get dirty looking. See how it's getting yellowing in here? Look at that real dark spot. All right? So this looks like the left eye. We'll take a look. That would be the parathyroid thyroid area if this is the left eye. That's not good. See how dark that is? That's almost degeneration of those tissues. That's what a thyroidectomy might look like. This would be down in the back. Let's see what I see before we read this because, all right. So this does look like the left eye here. Yeah, left eye. So this is what I see on the left side. A very chronic thyroid, parathyroid situation going on. You even have a weakness in the throat. Your middle back, lower back, definitely high genetic weaknesses in that. Your left kidney is weak genetically. Not too chronic, but your lymphatic system in the wall of your kidney is keeping it swollen. Your adrenal gland is somewhat chronic. Your rectal flexure is a little chronic, and so is the uteri. Your vaginal wall is really backed up if this is a female. Your groin is not filtering well. You're not moving lymph out of that left groin well. So be careful with that. Hip. A little bit of a pancreatic issue as well. And your left ovary is not a very happy camper. I will say that your left shoulder, it's real close to the mastoid area, is very weak in that area. And I would be concerned about having a little genetics in the heart area. Your chest wall here is real weak. Looking on the right side of the body, more confirmation of thyroid and parathyroid, not as weak as the left side, but involved. Your back, upper neck a little more, upper T or some of the C-spine involvement. You've definitely got kidneys on both sides. Your right kidney is almost weaker than the left. Your knee on the right side is not a happy camper. Got some spots in the hip. Your pancreas isn't that bad. There's a little bit of weakness in that. Your liver gallbladder needs to be cleaned up. Bronchial trunks, upper lobe, lower lobe. Matter of fact, in this upper lobe here on the right side, also you're moving up into this right shoulder problems. You've got one spot in the middle of the brain there that you want to make sure that you get more lymph moving out of your head and stuff, because that can become a brain lesion. It's at that level. That little spot right there. See that up in her head area? See that? You see the malabsorption ring around her pupil? And look how small her pupils are. Kind of tied to all this scleric blood vessels, skin ring. So you got a lot of lymphatics going on here, honey. You're a little bit of a skin ring. I'd expect you to have more because your thyroid, parathyroids are down. So you got some work to do. Pituitary, not so bad. Right side a little bit, but not so bad. But your sinuses and your head is full. You need to move out your lymph system head to toe. You're really backed up. She needs to be more like this, right? Than like that. A lot of lymph backing up. But the beauty of iridology is we get to see her lymph system. Now let's see what she has to say. Extreme PTSD and Sjogren's syndrome. Hi, Dr. Morse, my dear friend Mary Ann, highly recommended that I send my eyes to you. A good idea. This is Robbie. She's a 34-year-old female, 5'6". Although I didn't see a lot of pituitary, but there's so much lymph up there, you can suppress the function of that for sure. She's at 116 pounds. But you do have some malabsorption issues going on there, sweetheart. I have extreme PTSD, which I am working on in therapy, and I also have Sjogren's syndrome, which is a drying disease. You know why? Again, look at the difference. Look at the difference. Look at how much white and yellowing she's starting to get in her eye, and that's where she should be. A lot of lymph, sweetheart. A lot of lymph problems all through you. So you're going to be working on yourself for a while. In other words, all these pathways and stuff are backed up all through you. That affects my back and my eyes, my glands. Basically, everything can cripple up if I have a flare-up. And again, that's acidosis, and that's your lymphatic system. And you can really see your lymphatic system is a mess. And you really got to get yourself what we call hydrated, which is detoxification, but hydrated. That's why you see dry. Acids dry you out, dehydrate you. That's why when you're a runner and you're working with sports, you get dehydrated because kinetic energy burns, and then you burn alkaline energy, but you get acid buildup. And if you can't get rid of the acid buildup, then you just start building acidosis in the body. Then there goes the joints, there goes this, there goes that sort of thing. That's why all your athletes should make sure their kidneys are filtering. If not, ask yourself where the acids are going from cellular activity. I really appreciate your time and consideration in evaluating my eyes. Thank you for all that. Oh, you're a sweetheart, honey. Robbie, R-O-B-B-I. Yeah, you got to get yourself going. You don't want to dry out too much. You're only 34, and you've got a lot of lymphatic problems. Matter of fact, you're turning yellow around your pupil. You might have a few spots of sulfur, see a few places of orange, but I think that's more subacute, all this yellowing that you're seeing here that she's going through. But look how thick she is around the pupil, and that's a malabsorption ring right there. But this isn't good. This is parathyroid, thyroid, and that's your calcium utilization, your oxidation of nutrients. That's a lot. And then, of course, your height would suggest that you have some pituitary influence on that. Skin needs to breathe better, but that's your thyroid again. Check your basal temperatures under your arm. You need to be in the upper 97s, and my guess is you're not. Even though you're drying out and have maybe heat build up in the body, but that's where I would go. Because you either have to fix malabsorption. I think you need to clean up the liver gallbladder area. You need to drain this sinuses and get this. You got a spot up here. You got to fix that a little bit. Again, some shoulders going on here. Yeah. Some back weaknesses related to the above. So you need to strengthen yourself. And you can see the back weaknesses, skeletal. Your skeletal system needs to strengthen up, dear one, and that's your parathyroid glands. And when you look at your parathyroid, you're going, uh-oh. So then I would really recommend a parathyroid glandular in this case. Even if you did a 10, 20 milligram parathyroid twice a day, one in the morning, one in the evening. But I would get on the detox kits with the kidney, the lymphatic, the endocrine gland formula, and you might double dip with the endocrine gland formula. I'm telling you, don't like that. Try the nerve power for your PTSD, because it's a tonic for the nervous system, and your adrenals have got to be way down, honey. And that's your neurological system, and that's where you can get into some real serious PTSD, even autism, all the things that are involved neurologically in the body. And pull yourself out of this. We're here to help you. Get yourself pulled out of this. Make it a fun journey. Change your whole point of view and say, you know what, I'm on a health journey. I'm on a journey of regeneration. And to get there, you have to clean the sewer system. And your sewer system is really backed up. And that's what's drying you out and can burn you. I know cases right now where their lymph systems are burning back on them. And you just got to open that up, honey. And you'll be doing good. Get yourself going to Wellville. Get out of that Hellville. And you're, 30-something? Yeah, 34. You've been living with this all your life. Wow. So you're at the perfect age to get yourself well and have the rest of your life feeling good and not worrying about the loss of bone structure, the loss of knees, the loss of hips, saggy skins, everything that's coming your way. Yeah. You don't want to go there. And then your thyroid, parathyroid, you got to get them cooking, get them moving. All right, guys, thank you so much. That's all I have, Debbie. I have no more cases to go over. So I apologize for that. But I'm trying to keep up with you guys. Debbie's not trying to overburden me, so I love you, dear. But I'll be back one of these days this week. This is Monday. And we'll get cooking, see if I can help more of you guys. But keep it simple. Don't make things complex, because as soon as you do that, you lose the ability to help yourself. The medical doctor is so lost in complexity, they overlook the obvious and the simplistic. You can't do that, because then you're getting lost into genetics and treatments, and I can't help you, but you can take this drug and that drug, and it's just like it becomes body bizarre. Namaste, my guys.